Hey, it's Jessica DaMassa with WTF Health. I am here at HIMSS 19, and joining me right now, I have Niko Skievaski, and he is the founder and CEO of Redox.
Nice to be hanging out with you.
Nice to be hanging out with you too. So, in the land of interoperability,
yes.
We're going to talk to the man who's going to undo the need for an interoperability showcase, because everything will already be interoperable, so there will be no need to highlight it on the show floor. Is that right?
Hopefully, yeah.
Hopefully.
So the main idea around, so interoperability can be solved in 100 different ways for health systems and for vendors and for all the players in the space, but a lot of the solutions out there are kind of just solving it one by one, and the thing that we're trying to accomplish is creating a network such that interoperability is not a problem anymore. They're all just connected already. So when you need that data, there's a place to go to turn it on. So that's the kind of vision that we hope to see. And yeah, in that future, we won't need an interoperability showcase. Interoperability will hopefully be the least important thing, the least sexy thing to be talking about, and we can kind of get past that.
It's so sexy right now.
Interoperability is sexy. It involves tacos, it involves margaritoxes, but it should be a commodity. It should be something easily and available to everybody, like plumbing, like sewage, like the streets on our towns, and that should be how interoperability works.
Okay, so why doesn't it work that way? Because I mean, like, one of the things that I immediately think of to myself is I'm looking around this show floor here at HIMSS, and there's like millions and billions of dollars here invested in kind of keeping things not interoperable, right? Because all of these little companies then are going to go away. So I mean, so is the incentive within the industry aligned for interoperability the way that we hope it is?
So when we think about the warm and fuzzies in healthcare, like why we're in it, right, to help patients, the incentives are aligned. We want to help patients. But when we think about the cold hard business of healthcare, incentives are not necessarily aligned. And especially, we're moving towards value-based care, right? That's going to be great for the industry. We've been saying we're moving towards it for years. But value-based care actually has perverse incentives with interoperability. Interoperability enables a patient to shop, it enables a patient to use their data and go wherever they want. And interoperability is really something that will enable leakage for value-based organizations, and leakage is terrible for their business. So when we think about like the business incentives here, a lot of health systems have an incentive to keep their data closer to them, to keep their patients. One of the things that I think we can all agree on is the patient should have their data, but when it gets to the business, that's not necessarily the case. So the approach that I think will actually solve the interoperability problem is through technology adoption. So a lot of the technology, like the vendors that we see around us, need to be able to exchange data with electronic health records to run their products. So if we look at enabling interoperability through technology adoption, we're actually going to see the problem get solved. And as a byproduct of that, we'll be able to allow patients to have their data and move freely from health systems. But when we tackle the problem head on, it's a little too much business risk for health systems to swallow.
Is the strong advocacy for patients having their data, is that helping then or hurting their cause in the long run, if what you said is true? That it's like the patient liquidity of data will be a byproduct of the system changing the technology first, but it's like the patients are clamoring for it now, and so it almost feels like there's some of these like band-aid solutions being put in place, which kind of got us into this mess in the first place. So is that cry for data from the patients helping or hurting the cause?
Well, the thing is, patients aren't crying for data. They don't want their data. But
depends who you ask. If you ask e-patient Dave, he definitely wants his data.
Yeah, well, that's an early adopter, right? That's the fringe. But the average patient doesn't want their data. I've never requested my data from the health system. But what we need, patients don't want data, they want information. And information is the application layer. So applications turn data.
Say more about how you're differentiating those two things, the data versus the information.
Yeah, information is something you can use to change your behavior. It's valuable to you. Data is bits. And if you see your data coming out of a health system, it's a nasty XML file. It's not really human readable. You need some sort of application to turn that into something that is useful to you. And that's why the government has put so much effort around, really creating the infrastructure such that these applications can exist. In healthcare, we need the killer app to come out, but I guess in healthcare we shouldn't say killer app, but we need the app to come out that will actually engage patients. And in order for that app to come out, we need the infrastructure for the apps to be built upon. And that's the regulations that came out yesterday, 2 days ago now, is really about how do we get data from health systems, from providers, from payers, into hands of patients through an API structure. And those APIs are what these applications are going to be built upon. And then that's what's going to drive adoption from patients. Because patients don't want the data, they want the apps. They don't know they want the apps yet, but the entrepreneurs will find a way to make them want the apps. And that's the ecosystem that is trying to be developed right now. And hopefully once we can And the reason why the government needs to get involved and why this hasn't happened in a natural way like it happened in the financial industry or the airline industry where we have kind of more standard and open APIs is because of these convoluted incentives around releasing data to patients. And they're convoluted in a fee-for-service model. They're probably more convoluted in a value-based care model. So the government is basically stepping in to provide the policy, the rules of the game, such that it will create the infrastructure to make that possible.
Yeah, and to just make sure that everybody who understands kind of the rules that we're talking about, these are the ones that were released by HHS. They include ONC rules on electronic health information, as well as there's CMS rules in there as well. And this is like, I understand, a massively long document. Both of them are like hundreds of pages long. But no,
I've read it thoroughly many times.
Yes, right. And then the last couple of days here on the show floor at HIMSS, with your branded Redox highlighter, I'm sure.
Highlighting green.
No, and I want to ask about these regulations because they keep coming up, and I think they're going to come up more and more and more. And I'm curious to know, from your perspective as somebody who's working in this mess, are you happy to see these regulations? Are you kind of like, where the hell have these been for a while?
Yeah.
Or is it like, is the timing right for them? What's your sense here?
So I have mixed feelings. As an entrepreneur, I love the free market solving problems, but we've been trying to solve this problem for a long time. It hasn't been solved. There is a market failure here. And as an economist, I know when there's a market failure, you can use policy to help fix it. And so when I think about the policy perspective, I am glad that they aren't mandating specific solutions. Yeah. They're mandating an ecosystem of basically the rules that's saying you have to release data to patients. You should use standards to do that. We're all going to use FHIR to do that. Everyone knows that. Yeah. So it is setting up the right infrastructure for the private sector to actually solve these problems by setting up the rules of the game. So in a lot of ways, I'm like, okay, if I was a policymaker, I'd probably do it this way as well.
Okay, I want to ask you this because I thought this when they came out. I was like, I'm glad to see them, right? But at the same time, I was like, interesting that they should come out right now when we see when you talk about market forces shaping things, when it's like, oh, hi, this was like this past year was the year that we really saw Apple, Amazon, Google step into healthcare in a big way. I mean, it was no longer a toe dip in the pond. It was like they just plunged right in. So did you think at all that it was interesting that the timing, like would the market maybe have righted this out if we let those big guys deal with it? I mean, data is their wheelhouse.
Yeah.
And they've got a lot of sway. I mean, what do you think?
Now we can never know. It is now the counterfactual.
Way to get around that.
We were definitely seeing progress in the right direction, but it was progress being pushed by the big vendors, and it wasn't easy. There was a lot of friction in the market, and this is basically saying it is the right side of history. We all know that. It's going to happen, but hopefully it will happen faster because of the policy. What we've seen in the past is a lot of the policy focused more on B2B side. Yeah. It's like meaningful use 1 and 2 was really like how do vendors work with health systems. The policy now with promoting interoperability and 21st century cures is about enabling patients. And so, yeah, the market was going in that direction, but it's nice to see the policy shift from B2B to the consumer side, where we're actually going to see hopefully behavior change and these patients become actually healthier through being engaged in their care with hopefully a killer app that we haven't seen yet, but maybe one day this floor will be filled with apps that are for patients.
App showcase instead of the interoperability showcase?
Yes. Let's replace it with the consumer application showcase.
Fantastic.
That would be amazing.
Amazing.
Yeah.
Okay, last thing for you. Give us a state of the address here, a state of play on what's happening at Redox, other than the Redoxes that we consumed the other night at your HIMSS party. But I mean, like, so obviously you're well funded, right? You're closing a new round coming up here. Where are you guys at?
Yeah. So we started the company about 5 years ago. Yep. And basically had this vision for making a network in healthcare. But we didn't realize when that network would actually become a network. Because when you connect an app and a health system, that's not a network yet. They're two nodes talking to each other. About last year, we had about 100 health systems on the network. This year, we have 450. So we've started to see the acceleration of adoption.
You said you did that without adding staff.
Yeah, well, we added staff for sure, but mostly engineers to help make that network run more smoothly. So yeah, we did that without like increasing our sales and marketing. It wasn't a brute force growth. It was based on, we work with software developers sell their apps to health systems. We saw an uptick in technology adoption from health systems, which is phenomenal. We need that. We also saw these applications utilize this network to be able to move faster. And our whole goal is to streamline the technology adoption process at health systems. And so now we work with groups like the Brigham who turn on applications without having to get partner's IT involved every single time they do a project. So there's huge efficiency gains to doing that, and this next year we're going to see even more of that. And the way that we think about the work that we do at Redox, it started with interoperability because we look around the trade show floor and say, what does every one of these vendors have to accomplish to bring their product to market? And we're trying to build infrastructure to do that. But next, moving on from interoperability, we have patient identity problems, we have procurement problems in the health system, we have security questionnaires. There's this friction to adopting technology that we're trying to take out of the system so we can have more turnkey adoption of software. So you're going to see a lot more of that from us in the next year.
Yeah, and more parties, I'm sure. You're like the new Athena Health. When it comes to
those are big shoes to fill.
You heard it here.
We like buying tacos and we like buying margaritas, so come out to our parties, basically every conference.
Oh my gosh, well, thanks so much for joining me. It was great. Thank you also for speaking to me so candidly about interoperability. I love to hear about that when somebody is actually talking about, like, from big picture what's going on. I appreciate it.
Cool.
Thanks so much for your perspective, Niko. I'm Jessica DaMassa with WTF Health. Thanks for joining us.